So let's talk about the efficacy of whole body vibration. And usually I'm talking about it because women 40 plus are losing bone and muscle mass. And the reason I'm talking about whole body vibration is we know that the whole body vibration plate can help with bone density and how you remodel. But let me show you some research. Here is a systematic review from 2023, effectiveness of whole body vibration on bone mineral density in postmenopausal women, a systematic review, meta-analysis of randomized controlled trials. What is good about this is the reason they are looking at postmenopausal women, this is a group that has the most significant amount of bone loss. And let me show you what they found. So when you start at the abstract, the present study observed significant effects of whole body vibration on bone mineral density in postmenopausal women with high quality evidence for high frequency, so 30 hertz, low magnitude, and a high cumulative dose, meaning bone takes time to remodel. This is not a quick fix. I am usually talking about that you need to do whole body vibration 3 times a week. Bone remodeling takes time, so like for a year, it's going to take time to make change. And when they broke it all down, there were 13 studies that were high quality and they had control groups, there were randomization. But of course, what happens in exercise studies, and this would be counting as an exercise study, is the protocols are exceptionally different. But they did see that there were significant effects of bone mineral density in the primary areas of lumbar spine, the lumbar spine, and consistently across all groups to be helped by whole body vibration. They did find, though, in women under 65 who are also postmenopausal, that it did also help in the femur, so the hips, and the lumbar spine. And so consistently what comes up, high frequency, so 30 hertz, and long cumulative, like the frequency of your treatments matters more than the time spent on the vibration plate. So like I said, 30 hertz, and they said a low magnitude and a high cumulative dose, 7,000 minutes. They later go on to say in another study that 108 sessions in a year, which works out to 3 visits a week or 3 sessions a week. In a different article from 2018, another systematic review and meta-analysis, they came out and said whole body vibration is an effective method to improve lumbar spine bone mineral density in postmenopausal women and older women to enhance femoral neck bone mineral density in postmenopausal women younger than 65 years. And so whole body vibration is a wonderful complement for healing because it is an alternative exercise intervention that has been shown to help increase bone density due to mechanical load. And this is what I think a lot of people miss. It is the mechanical load of whole body vibration. Even though you are not moving around a room, your knees are flexed, there is vibration, which makes the tonic vibration reflex turn on, which makes a lot of your muscles contract. This is why I also will tell you it supports your lymphatic system. Although the research for the lymphatic system and whole body vibration is not quite there, lymphatics is not a high realm of research and priority, but I do have a different study for that at a different time. So this study goes on to say that the vibration training requires a great response for the muscle and bone tissue to absorb and dampen the energy caused by the oscillations. And it has been shown that whole body vibration can produce an osteogenic effect, counteracting age-related bone loss. And if you've been listening to me, once you hit 40, I need you to care about your bones. I need you to care about your muscles. I say you lose about 1% per year, but technically the research will say it is 8% per decade, but like it varies. But the reason I say 1% is because depending on where you are in your hormonal shift, your late perimenopause and early postmenopause is where we lose the greatest amount of bone density. And in this way, I feel prevention is better than treatment. Of course, the research is going to be done on postmenopausal women because their hormones have left. Estrogen helps our bones remodel, and nobody cares about prevention and research. Like, we would need a long haul, years study, like a big fat study to show whole body vibration prevented osteoporosis. The other complicating factor is when you're actually doing a study design, I think they would also exclude women who are doing hormone replacement therapy because they would say it would alter how their bones remodel and not show the pure effectiveness of whole body vibration. And so this is why when you look at the research, you're like, well, why are you talking about postmenopausal? Because they have a disease process happening called osteoporosis, and that's the only reason they're going to do research, because no